welcome everybody to our next episode here in the Tiny Room. I'm Lucinda Jane Valentine. I'm the owner and lead therapist here at the Tiny Room Counseling and Therapy Practice. And we've got an awesome guest with us once again. It's actually one of our team, new to our team, Kirstie van Blerk. Thank you for being here. Kirstie's got some really cool stuff that she wants to chat about, so I want to give her all the time that she deserves. It's quite a important topic. It's hopefully going to speak into some of the things that some of you that are watching are dealing with, and helpful tips, I'm sure. But Kirstie, thank you for being here.
Thank you for having me.
And I'm excited to get into postpartum depression, but also just depression as a whole, and how to be a support to a loved one. And I'm just going to hand it over to you, because I know you've got a lot of experience, and also, or first-hand experience, but also studies behind the whole clinical side, and I think even more so than myself. So go for it. Like, what is on your heart? What do you want to share with our viewers who are possibly in that pit, in that trench, dealing with some of the stuff that we want to get into today? I'm just going to let you guide the conversation, and here and there I might just prompt and I don't know, ask you to unpack and lay out or flesh out the details of it. So where would you want to start? Like, how does this look? Put us in the picture. I don't know if you want to go straight into postpartum depression or somebody that's having a depressive episode. Go for it. Where would you want to start?
I think a good place to start for the viewers is to, because I'm now talking to the loved ones of a person with depression, right? Because it's sometimes very hard from the outside to understand what's going on.
Yeah.
And I think a good place to start is, what does a depressive episode look like? What
Yep.
does it feel like? So from the outside, what it looks like is somebody being much more sleepy than usual, low mood, irritable, maybe not able to sleep, like a different sleep pattern, and they call it anhedonia, which is the inability to feel pleasure in anything.
Okay.
So that's like, maybe you were, your partner is normally a painter or a gamer, and they're just not finding any pleasure in any of the things that they used to find pleasure in.
Alrighty.
So, you know, that with some weight changes, appetite changes,
Hygiene?
big hygiene changes, yes, yeah, any changes in behavior. So that's what it looks like from the outside, and often that can be misconstrued as being lazy or being demotivated. But what it feels like on the inside is a deep, deep darkness that you just cannot crawl out of.
Yeah.
It's like something is pulling you down, and it is so hard to escape from, and people don't get it.
Yeah.
And that makes it feel so much worse.
Because I'm also thinking, I think of my tweens and my teens, because I see Kirstie helps out with the adult English clients, and then Mandy, who's on our team, Afrikaans adult clients, and I focus on the tweens and the teens. And a lot of the parents of our tweens and teens think that the teens are, or tweens and teens, are being antisocial, are being loners, and are framing it negatively. Now, there's a difference between an introvert, you know, and a depressive person. So I always try and get parents to understand that an introvert recharges on their own, so possibly your child is just the introvert. But then also just keep your eyes on and be mindful of these symptoms. Where is it depression? You know, are they going through a depressive state? Or so equipping parents, but also as an adult who's maybe going through this, and like you said, a loved one, so like a partner, you know, if it was your husband or if it was my husband, what to look out for, how to assist. So if you pick up some of these red flags, like, what then?
So the big thing is, like you said, there's a difference between an introvert and a person in a depressive episode. The big thing to tell is it a change? Is it different?
Okay.
And does it last for about 2 weeks? I mean, there's days where you're sad. It is.
Yeah.
It is. So when it lasts about 2 weeks, you can confidently say, okay, this is a depressive episode.
Okay.
And what then? Like you said.
Yeah.
So how does a loved one support somebody with depression? Right? I'll get into the postpartum thing now, because that's quite a specific part of it, but you need to understand depression on its own.
And there's different types.
Yes.
There's different types of depression, by the way.
Yeah. So you know, how do we support a loved one with depression? The first thing to do is to know what not to do.
Okay.
Because you don't realize it, but when you have a loved one that's in a depressive episode, you have got the ability to make them go further down.
Okay. Makes
and
sense.
It doesn't take a lot to do that.
Okay.
All it takes is a well-meaning comment as, just look at all the things that are going right in your life.
Yeah.
Yeah?
Happiness is a choice.
Yeah. It's not a mindset. Depression is not a mindset.
Oh my goodness, I can only imagine how that would piss me off.
Yeah. So, I mean, and it's so well-meaning.
Yeah,
It's just because we don't know.
Yeah.
So that's why I want to educate people to know that can make it worse.
Yeah.
You know? My husband once, my husband suffers from major depressive disorder, which is why I'm so passionate about it.
Yeah.
And he once had a friend tell him, when he told him that he was on medication to help, his friend said to him, but no, just throw that stuff away and just think positive. And I mean,
it's like the worst thing you want to hear when you're in. It's not a sad day, guys. Okay, it's not a sad couple of days. This is on a whole nother level, a whole nother ball game.
Yeah.
It would trigger. It would make you feel worse.
Makes you feel like there's something wrong with you.
Yeah.
And there's nothing wrong with you.
Yeah.
There's nothing wrong with somebody that's in a depressive episode. It happens.
Yeah.
Right? And it's the same as if you developed a carcinoma or something like that, but you can't see it. Other people can't see it. So we think it's inside the head.
And don't take it seriously when you don't see your arm chopped off or something, you know?
Yeah.
Yeah.
So, okay, so what next? We don't do that. We don't do those things. What we do need to do is we need to be present for that person. All right? And we need to have unconditional regard for that person.
Love it.
Completely unjudgmental. All right? No judgment there, but also not enabling the negative behavior.
Okay.
So there's a tricky line there.
Yeah.
But that's something that comes with practice. You know, if you're a seasoned depression wife,
tell us, Kirstie, help us.
You learn those tricks. But essentially, when a person is suffering with that storm zone, you know, when you're in the stormy phase of depression, saying to them, here, watch this video, it's very helpful. Here, read this self-help book, it's very helpful. It's going to go over their heads and it's just going to make them feel worse. So you need to monitor that and say, okay, when are they in the stormy phase? When are they in the just slightly cloudy phase? When are they in the just drizzly phase of depression? Right? And based on that, you can then accommodate your suggestions for them and your assistance to them.
This is so good.
So when they're just having like a cloudy day, because depression is like that. One day you feel like really, you can't get out of bed. You can't open the curtains. Just everybody leave me alone. I can't eat. I can't shower. I can't do anything. It's just too heavy. The next day feels like a little bit lighter. I can move around, but I don't want to talk about it. And I just sort of am autopilot. And then it's just kind of chops and change. But you're not yourself. For at least a period of 2 weeks for it to be a depressive episode. So you learn to recognize where they're at. So when they're in that very cloudy phase where it's not so bad that they can't get out of bed, then you can suggest to them, you know, let's get you a coffee date with one of your good friends. You can just talk to them.
So those injections of support, but knowing where, it's almost like you're regulating, but in order to regulate correctly, you need to have experience, but hopefully we can learn now from Kirstie's life experience and walking this journey with somebody, is knowing when to inject or suggest, as you said, certain almost like interventions in a way, but just gently bring, and also knowing the person, knowing what is actually going to be the best suggestion for them during those different phases. I'm hoping that we can actually, in this episode, underneath in the description, put down some of the points of these phases so that we can kind of have it as a bit of a note somewhere and have it as a guide. I mean, it would be so helpful. I'm learning a lot just listening. So, okay, so then giving those suggestions, knowing those phases basically, then what? Like how, obviously there's different types of depression. So you were saying that your husband has...
Major depressive disorder,
Okay, so major depressive disorder. what is it like for somebody who has chemical, I mean, I've got a few clients that have chemical depression, and people don't understand what that is and how that unfolds and how that looks. Then there's severe to moderate depression, and that's different to major depressive disorders. So without going too in depth, just overarchingly, yeah, what can we do to help viewers to understand when it comes to chemical depression? How can we be of assistance to them, severe and moderate? I mean, medications involved with some of those levels or some of those types of depression. There's psychiatric assessment that needs to be done. We aren't psychiatrists. We don't diagnose and medicate. That's a medical practitioner that will do that, which is either a GP or a psychiatrist. And then quite a few GPs don't do psychiatric assessment. So there's referrals that need to take place. Great therapy is needed with somebody that is, diagnosed with something like this, and it can be very helpful and effective. We've got quite a few clients that have different types of depression coming through our doors. Throwing that all out there, what are some of the things going through this in your life with your husband, learning about it in your masters? What are some of the things that the myths that you want to debunk, the gaps that you see in education, and then also with some tips and tools? Like, it's a lot that I'm throwing out there, but just go for it. Like, what do you want to kind of share from your heart that's kind of bugging you and everybody should know, or what you feel will be of assistance to somebody watching?
So a big thing to realize with depression is that if you find yourself with a mild depression,
okay,
right? So that's like you're depressed, but it's not repeated major depressive episodes.
Okay, so the 2 week stints are not happening
like very constant.
Okay.
Then you can get away with therapy on its own.
Okay.
A one-pronged approach, just therapy.
Love it.
Right? If you have a good therapist and you've got a good framework that you're working with, that will suffice for mild to moderate depression. If you find that your depression is very severe or very persistent, or even if it's like dysthymia, which is just this depressive state, it's not a 2 week episode, it's like a constant depressive episode that happens. If you find yourself with that sort of experience, then we say you need to have a 2-prong approach in order to actually get results, which is one prong is therapy and the other prong is medication, and SSRI or something along those lines, which a psychiatrist or a GP would be able to, a good GP would be able to prescribe for you. And the thing with medicine that I would like to debunk about it is that it's not, here's a happy pill and now be on your way. Firstly, it takes about 2 weeks to see any kind of result from an antidepressant. And secondly, you're going to need to work with a medical practitioner to get the right dosage, to get the right medication for you, because everyone's different. Everyone's bodies react differently, and everyone's depression is a different experience.
And the dosage too.
And that's not going to change, it's not going to change your life like that. You're going to need to do it in conjunction with therapy. You get yourself a very good therapist and you work with them and you build a relationship, and it has to be somebody that you feel very comfortable with and you trust. And it's constant work.
And knows your diagnoses, understands the realities, not just on paper, but also how this looks in that individual, that unique individual's life. And that's what I see. We have clients who are from all ages that are severely or moderately depressed, and they're having great results with our therapy framework and our process here. And some of them do have some meds, entry level, dosage is maybe lower. But then we have clients who are not regularly, maybe once a month, every say 3rd month, going to their psychiatrist, having their meds monitored, maybe upping their dosage, and it's with relationships. So us as therapists here at the Tiny Room, we have connections with those clients' psychiatrists, and we work within that partnership of care for our clients. The client is their patient, they are client, because we are not medical practitioners, therefore it's their patient. But there's this relationship and this partnership in that whole, or that holistic care. But like you said, it needs to be a therapist that understands, has the experience, has the advanced studies. We give therapy here, not counseling. And everybody should know by now what the difference is between the two. We educate quite a bit here. And it needs to be effective therapy and not just surface level, because we have clients coming from all walks of life. And I like that you say about the two-pronged approach, because we know if it's going to be a one-prong or a two-prong. We offer both. So sometimes people will be like one prong, not in partnership with their psychiatrist, speaking completely different languages. The client is feeling overwhelmed with these two pathways, instead of just kind of making it as simple and as effective and easier for them. And I feel like we're really doing a great job here. So grateful for you. So now moving along to, that's the support. I don't know if there's more, if there's anything more that you want to add to being a support with somebody that's in your family, a loved one that is going through all of this. How can we be equipped to not be adding extra to what they're already going through? I don't know if you want to go into even having a partner who is then possibly going through postpartum. I don't know enough, because I haven't experienced it firsthand, and it looks differently for everybody, but just overarchingly, if they do experience this, what are the symptoms of that?
So a postpartum depression for me is one of the scariest things that can happen to somebody, because given everything I've just told you about depression, and I mean there's so much more, I'm obviously just trying to be time effective here, but given everything about that, imagine experiencing that and then being sent home by yourself to look after a new baby that you don't know. You don't have any idea what to do. I mean, you've been to all the classes, you've done all the readings, and you get home and the poop is a strange color and all of that goes out your head and you panic. But now trying to do that, add in sleep deprivation, massive sleep deprivation, add in the hormones, the change in your hormones go berserk after you've had a baby. I mean, never mind the fact that your body hasn't been yours for the past 9 months, but and in the fact that none of your clothes fit you, and there is some kind of bodily fluid on everything that you own.
Oh my goodness, it's a lot.
Your husband has to go back to work after 10 days. If he's lucky, he gets 10 days paternity leave, but most of the time that's not.
No, it's maybe 2 days, if that.
Sometimes you've got a toddler at home you've still got to look after while trying to sort all of this out. And the idea of all of that on its own is so overwhelming. Beautiful, yes. Lovely. But it was never meant to be done on our own as mothers. It was meant to be done in a community. But society has changed and our expectations of mothers are so big and unrealistic, actually. So now take all of those experiences and add in a deep, deep darkness that makes you feel like you can't, that you have these intrusive thoughts of, I don't know what I'm doing. This child would be better off with somebody else. And that is so scary, because they won't. That's very, very untrue. Those intrusive thoughts are always untrue. But that child needs you as the mother, and they need you to be the best version of yourself for them. And sometimes that means handing the child to somebody else and going to get help.
And what does that help look like? Because those intrusive thoughts can be even way worse than that, where to the point where this child would be better with someone else, that there are suicidal thoughts that are thrown in there. And we've been seeing in the news globally lately of moms who are committing suicide during their postpartum, and I've had some clients that have had those thoughts and have had to be on 7 different antidepressants during that time, and it's 2-3 months of hecticness. And I mean, it's the time where you want to bond with your child. There's so many things going on. And then what if you do have a partner who's also going through stuff that can't be as much of a support as what someone else would be? It's a lot. It's just a lot. And like where do you go to from there? I mean, if you don't have that support system and you do grapple to try and get somebody on board, what would you want to say to somebody that is maybe experiencing it right now and maybe watching this? I mean, what would you want to say? Because you've gone through it. What happened for you? Like, how did you get out of that? What worked? What didn't work? I mean, let us into that world. because it's a dark space.
It is a dark space. And I mean, what I did was I pushed everybody away, which is not what I needed, obviously. I needed the opposite.
Okay.
And I found that, so in order to support somebody with postpartum depression, go back to basics.
Okay.
Go back to, what is this supposed to be like? Surely it shouldn't be this hard.
Mm-hmm.
Think about the villages. Think about people living in close quarters with each other. Think about families living together where there's not this expectation that you must go out as a couple and go live by yourselves and support yourselves and do everything on your own and individual. That's a very, very modern way of thinking. You need your grannies.
Yeah.
You need your grandpas. You need your uncles. You need your aunties. You need your brothers, your sisters. Everyone needs to be involved, because that is where the healing comes from that community, from that family. Even though, and the person that is depressed is not going to reach out and ask for it, because they don't know how.
Okay.
And they don't know that that's what they need. They know they need help, but they don't know what that looks like.
I love that. That is so true.
So the partner or somebody that can actually identify it from the outside needs to start mobilizing the community and saying, okay, you know what? You have got this, and this to deal with, and I can see you're not coping. So you know what? We're going to create a roster and with your friends, and this person is going to bring you dinner Monday and Wednesday. This person's going to bring you dinner Thursday and Friday. Then Granny's going to come over on Fridays. She doesn't work, so she's going to come over, and you're going to use that time to go for a walk or to the library or
shower.
Have a shower. Have
a lot of my
friends,
have a shower.
Yeah.
Wash your hair.
Go out for coffee with a friend.
Yeah.
But that person, you need to understand, saying to that person, you need to do this, this, and this, is going to just fall on deaf ears, because they can't. They can't do it for themselves in that space. So somebody needs to mobilize and do it for them.
And the red flags, I mean, there's obviously going to be levels of postpartum. What are some of the warning signs, or like I said, the red flags, to know if it's just somebody that's overwhelmed and if it's actually a situation that should be taken quite seriously? Or would you say that it's just best to put that system in place no matter what? I mean, it sounds really good. I mean, you would want that, and I agree with you. It does take a village. Why do we do it this whole contemporary modern way? I don't think it's how we were designed to actually live in isolation. I think connection is key. What's your thoughts on that? Like, what are the warning signs or the red flags for postpartum?
So the red flags for postpartum are obviously a little bit different to normal depression, because sleep disturbances, weight changes, irritability, that sort of comes with the territory, doesn't it? So otherwise we're going to be diagnosing everybody with postpartum depression. So, I mean, the warning signs, firstly, is it's within the first year of having a baby, you can develop postpartum depression. So it's not always with the newborn.
Wow.
You know? But generally it happens within the first 6 to 10 weeks.
Okay.
And one of the major signs is a lack of bonding with the baby, a lack of interest with the baby. So normally when everything is working as it should, baby cries, mom feels this very, very primitive need to see to baby.
Yeah.
Right? When a mom is suffering from postpartum depression, that's interrupted. Baby cries, mom feels either nothing, or feels irritability, or feels anger towards the baby.
Alrighty.
And that bonding then is interrupted, and that bonding is so important for the baby. So that's why it is really, really imperative that intervention happens quickly. Because that baby is developing their sense of the world, their sense of themselves. So if they're not able to properly attach, this is where attachment theory comes in. If they're not able to properly attach to mom because she is absent, mentally absent, not physically absent, then that child is going to grow up with attachment issues. Yeah,
the first 1,000 days are so important. I'm very passionate about that. If you don't know about the first 1,000 days, we'll do an episode on that. Bring you back in the tiny room. But the attachment, as you said, but it's also even with the latching of breastfeeding. It comes down to, I've seen moms feeling as though this baby is an absolute, like you said, irritation, but like a burden. It's like, why type of thing. And I've heard all the different ways that it unfolds, and it looks different for everybody, but there's that underlying common thread of of that irritability, that frustration.
And it's nothing to be ashamed of.
No, exactly.
Nothing.
That's what we're talking about it, because it should be spoken about.
Yeah.
You are not alone.
Yeah.
This is actually happening more often than what we think, because people aren't talking about it. And we are going to talk about things here in the tiny room when it comes to mental health, to what's happening out there in reality. All the things, I want to say taboos, but all the things that aren't spoken about: self-harm, suicide, suicidal thoughts, postpartum, miscarriage, stillbirth, cot death. We need to speak about these things. Grief. I almost kind of sense that, I don't know how to frame this, but I find even with postpartum, listening to people's different stories of how it unfolded, is having a sense of kind of grief where their lives come to an end, type of thing. So I don't know how it unfolded for you, or if you've seen this or heard this, but I pick it up slightly. And then even trauma, there's a trauma during that time too, so it's layered. It's got a lot going on.
It's very, very layered. I mean, but risk factors for postpartum does include a very traumatic birth experience. So if your birth was your labor was very long, your birth was very difficult. My firstborn was had to be pulled out with the vacuum.
Oh
thing.
goodness!
Not a vacuum cleaner. But
yeah. I'm sure we're picturing that, but I mean, I know what you mean. The suction.
Yeah. And that was very traumatic. And then we had feeding difficulties, which complicated everything. And then I had all these breast Nazis telling me you must breastfeed, otherwise you're failing, you must breastfeed. And that, that makes it so much worse. Eventually a pediatrician said to me, your mental health is way more important. Just give the child formula.
Oh.
She needs to eat.
Come on.
Yeah.
I mean, do what you need to do.
Is
the child being fed? It's being fed.
Fed is best. So also those expectations on what you must do, trying to be the perfect mom, especially first time mom. Second one I was like, I got this.
I know, hey?
But first time mom, that pressure is so intense because there's so many books, and you know what? They actually don't mean anything at the end of the day.
Yeah.
You need to make sure that you're sorted out so that you can sort them out. And it's not something it doesn't always come naturally like it's supposed to, like you think it's supposed to.
Those expectations are really, I and my clients know, and here at the Tiny Room we advocate for this. Drop the expectations.
Yeah.
Expectations on goals. Let's just drop the expectation and do our best.
100%.
We flesh and bone, we human. Okay, so we're gonna always be disappointed if we constantly have these expectations based on society and apparently this perceived expectations that books, tell us how to do our lives and stuff like that. It's let's just bring it down to a normal level, and just do our best. Like you said, fed is best. Just, is the child happy?
Yes.
Are we okay? Let's get through this. Do what we need to do.
And obviously, if you feel like there's a postpartum depression, remember you've got baby blues, which is very, very normal and very expected because of all the hormones and because of the change in your life and the grief over your lost independence.
Yeah.
Because now you're living for somebody else.
Yeah.
Their needs have to come first, and that's a big shift in your mind. And for some people, it's okay; it comes naturally. And for other people, it's really hard. For me, it was very hard. I didn't think it would be, but it was. And that baby blues must be monitored. The constant weeping, the feeling very, very sad, but you're still in tune with your baby.
Okay.
You're still bonding with your baby. You still want to be with them. You still have that very protective nature over them. You don't feel like you can't get out of bed or lift your head from the pillow.
Alrighty.
You don't feel like you want to escape. You want to go have a shower, but you don't want to run away.
Yeah.
You don't want to jump in front of a truck. You don't want to do, the minute you start having suicidal thoughts or infanticide thoughts,
you've crossed the line.
then you've crossed the line, and we need to get you help ASAP.
Yeah.
All right. And there's no shame in getting that help because it happens to, I think if I'm correct, the stats are about 10 to 20% of women experience postpartum depression.
And I think it's more than that because we just don't talk
about it. So get to a doctor.
Love it.
Get medication, because you know what? I don't actually care what your thoughts are about medication and therapy, if you're old school minded or what it is.
Yeah.
This child needs to be cared for, and you need to do what you need to do to get that child cared for.
Kirstie, thank you so much for being a guest on our podcast this week. We are so grateful for your heart and for your passions and for the focus areas that you are bringing within our mental health care services here at the Tiny Room. To all our viewers, we love you and we hope that we are adding more value by having such an amazing team to do life with you. If you are needing any assistance, any support, any help, please reach out. You can get us on social media, on Instagram. Please subscribe to this YouTube channel, like this video so that we can get it out there to more people. You never know who you could be helping by getting this information out there, that there is a place that does therapy very differently and that it's therapy that works. So we love you. We'll see all of you soon and we look forward to our next amazing guest. Bye for now.
Hi, so just a little bit about me. I'm currently doing my master's in clinical social work, so I'm very passionate about mental illnesses. I love to support clients through a new diagnosis or, educate the families and loved ones of those that have been diagnosed with mental illness in how to support their loved one. And I've also got experience in a lot of grief therapy and assisting and supporting those through the end of life process. I'm very passionate about palliative care and providing dignity to those that are dying and assisting their families through that process. And I'm just very, very excited to be helping at the Tiny Room and be able to support those that really, really need some assistance. And I'm looking forward to meeting all of you. Thank you so much for giving me this opportunity. I really am humbled and so appreciative that people are allowing me into their lives and allowing me to walk along this path with them. So thank you. I look forward to it.